Pacifier pros and cons. As a parent, you will be faced with lots of decisions when it comes to your child and their well-being. You will undoubtedly try your best to make the right ones. Sometimes you will succeed, and sometimes you won't. Naturally, when faced with decisions, you may hop online to do some research, and there you will be faced with an overload of information and biased opinions, which can make it all the more difficult. One of the hotly debated topics is about pacifiers, whether to allow your child to use one at all, and if so, for how long. Below are some pros and cons presented in an unbiased way that can hopefully help you decide what works best for you and your child. What's important to remember is that you know your child best, so you are in charge of these decisions and should follow your instincts. The pros and cons of pacifiers. The pros: soothing. For some infants, pacifiers can offer contentment in between meals or for when they need comforting. Temporary distraction. If you need another minute to prepare something, to take a quick phone call, or to comfort your child while they get their shots, etc., pacifiers can be a good distraction. Travel aid. Pacifiers are one solution to help ease discomfort associated with pressure buildup and release in your child's ears during flights. Sleep aid. Some babies fall asleep easier with a pacifier. It can help to calm them or put them back to sleep in the middle of the night if they wake up. Easier to stop. Pacifiers can be taken away where other habits like finger sucking can be harder to stop. SIDS prevention. According to the American Academy of Pediatrics, a pacifier might help reduce the risk of sudden infant death syndrome (SIDS) if they suck on them during nap and bedtime. The cons: breastfeeding interference. If introduced too early on, a pacifier may prevent your baby from sucking effectively during breastfeeding, which in turn can affect your breast milk supply. It is recommended by the American Academy of Pediatrics to first settle into breastfeeding before introducing a pacifier, typically between 4 to 6 weeks. Dependency. If your child loses his/her pacifier while sleeping, they may constantly wake up each time it falls out of their mouths. Dental issues. Prolonged pacifier use or thumb sucking after the first few years, according to many dental professionals, can eventually be a concern for the growth of the mouth or alignment of the teeth. Speech issues. If your child continues to use a pacifier as they develop some language and constantly has a pacifier in their mouth during the day, they may not have the same practice speaking or enunciating as they should at that age. Health concerns. Using a pacifier may increase the incidence of ear infections. However, ear infection rates are lowest during the first 6 months when a child might need the pacifier most, and the risk of SIDS is highest. Unsafe materials. Not all pacifiers are created equal, and you don't want your tot sucking and gnawing on materials that could leach potentially dangerous chemicals and materials. If you do decide to use a pacifier, opt for 100% natural rubber latex that contain no PVC, BPA, phthalates, or artificial colors. The concept of pacifiers has been around for a long time, and the use of pacifiers is something that is not going to go away anytime soon. Being a little guy or gal is hard work, so if a pacifier can help your child feel better, then use it. If your child is not interested, great, no need to force it. There are other recommendations to decrease the risk of SIDS. You need to decide what is best for your child. If you use a pacifier, there are many creative ways to help give up the pacifier when it is no longer needed. If you do opt to use one, choose wisely and choose pacifiers that are made from natural, baby-safe materials that won't leach potential toxic chemicals.